Numbness is a sensation many people experience at some point in their lives. It can feel like a loss of feeling, tingling, or even a pins and needles sensation. While it's often harmless and temporary, sometimes numbness can signal a more serious underlying issue. In this video, we'll explore what causes numbness, the different types you might encounter, and how to recognize when it's time to seek medical attention. Let's start by understanding what numbness actually is and why it happens. Numbness is defined as a partial or complete loss of sensation in a part of your body. It can affect your hands, feet, arms, legs, or even your face. Sometimes numbness is accompanied by tingling, burning, or weakness. These sensations are usually caused by issues with nerves, which are responsible for sending signals between your body and your brain. When these signals are disrupted, numbness can occur. Let's look at some common causes next. Most people have experienced temporary numbness, like when your foot falls asleep after sitting in one position for too long. This happens because pressure on a nerve or reduced blood flow interrupts the normal signals. Once you move and relieve the pressure, the sensation usually returns to normal. This type of numbness is generally harmless and goes away on its own, but not all numbness is so simple. One of the most common causes of numbness is nerve compression. This can happen when nerves are pinched by muscles, bones, or other tissues. For example, carpal tunnel syndrome causes numbness in the hand due to pressure on the median nerve in the wrist. Similarly, a herniated disc in the spine can press on nerves, leading to numbness in the legs or arms. Relieving the pressure often helps restore normal sensation. Another reason for numbness is poor blood circulation. When blood flow is restricted, nerves may not get enough oxygen and nutrients, leading to numbness or tingling. Conditions like peripheral artery disease or even sitting with crossed legs for too long can cause this. Improving circulation by moving around or treating underlying conditions can help reduce numbness caused by poor blood flow. Direct injury to nerves, such as from a cut, trauma, or surgery, can also cause numbness. When a nerve is damaged, it may not be able to send signals properly, resulting in loss of sensation. Sometimes the numbness is temporary and improves as the nerve heals. In other cases, especially with severe injuries, the numbness can be permanent. Protecting yourself from injuries and seeking prompt medical care can help prevent long-term problems. Certain medical conditions can cause chronic or recurring numbness. Diabetes is a common example, as high blood sugar can damage nerves over time, leading to a condition called diabetic neuropathy. Other conditions like multiple sclerosis, stroke, or autoimmune diseases can also affect the nerves and cause numbness. If you have a chronic illness and notice new or worsening numbness, it's important to talk to your doctor. Your body needs certain vitamins to keep nerves healthy. Deficiencies in vitamins like B12, B6, or E can lead to numbness and tingling. These vitamins help maintain the protective covering around nerves and support their function. Eating a balanced diet or taking supplements as recommended by your doctor can help prevent or treat numbness caused by vitamin deficiencies. Excessive alcohol use or exposure to certain toxins can damage nerves and cause numbness. Alcohol can interfere with the absorption of important nutrients and directly harm nerve tissue. Some medications, heavy metals, or chemicals can also have toxic effects on nerves. Limiting alcohol intake and avoiding exposure to harmful substances can help protect your nerve health. Certain infections can affect your nerves and lead to numbness. For example, shingles, Lyme disease, or even some viral infections can cause nerve inflammation or damage. Infections may also cause other symptoms like pain, weakness, or fever. If you suspect an infection is causing your numbness, it's important to get medical attention for proper diagnosis and treatment. Some medications can have side effects that include numbness or tingling. Chemotherapy drugs, certain antibiotics, and medications for HIV are known to sometimes affect nerve function. If you notice numbness after starting a new medication, talk to your healthcare provider. They may adjust your dose or switch you to a different medicine if needed. Believe it or not, anxiety and stress can also cause numbness. When you're anxious, your body's fight or flight response can change blood flow and muscle tension, sometimes leading to tingling or numbness, especially in the hands, feet, or face. While this is usually temporary and not dangerous, managing stress through relaxation techniques can help reduce these symptoms. While many causes of numbness are harmless, some situations require urgent medical attention. If numbness comes on suddenly, is severe, or is accompanied by other symptoms like weakness, difficulty speaking, confusion, or loss of bladder control, it could be a sign of a serious problem such as a stroke or spinal cord injury. In these cases, seek emergency care immediately. Stroke can cause sudden numbness, especially on one side of the body. Other warning signs include trouble speaking, facial drooping, vision changes, and loss of balance. Time is critical in treating a stroke, so if you or someone you know experiences these symptoms, call emergency services right away. Early treatment can save lives and improve recovery. Numbness that affects both legs or is associated with loss of bladder or bowel control could indicate a spinal cord problem. Conditions like herniated discs, spinal cord injury, or severe infections can cause these symptoms. Prompt medical evaluation is needed to prevent permanent damage. Don't ignore numbness that affects large areas or is linked to other neurological symptoms. If numbness gradually spreads or worsens over time, it could be a sign of a progressive nerve disorder. Conditions like multiple sclerosis or peripheral neuropathy can cause symptoms to develop slowly. If you notice numbness that is getting worse or spreading, make an appointment with your doctor for a thorough evaluation and diagnosis. Numbness that is accompanied by weakness, difficulty moving, or loss of coordination can be a sign of a serious neurological problem. These symptoms may indicate nerve or brain involvement and should not be ignored. Immediate medical attention can help identify the cause and prevent complications. Complete loss of sensation in an area, especially if it happens suddenly, is always a reason to seek medical help. This could be due to nerve damage, stroke, or other serious conditions. Early intervention can make a big difference in recovery and long-term outcomes. Numbness that affects your face, especially if it's only on one side, can be a sign of a stroke or Bell's palsy. Both conditions require medical evaluation, but a stroke is an emergency. If you notice facial drooping, trouble speaking, or vision changes along with numbness, call for help right away. While numbness is less common in children, it can still occur. Causes may include injuries, infections, or even migraines. If your child experiences numbness, especially with other symptoms like weakness or confusion, consult a pediatrician to rule out serious conditions. Pregnant women may experience numbness, especially in the hands or feet. This is often due to fluid retention causing pressure on nerves, such as in carpal tunnel syndrome. While usually not dangerous, persistent or severe numbness should be discussed with your healthcare provider to ensure there's no underlying problem. As people age, numbness becomes more common due to age-related changes in nerves and blood vessels. Chronic conditions like diabetes or arthritis can also contribute. Older adults should monitor new or worsening numbness and report it to their doctor, as it may signal treatable conditions. Diagnosing the cause of numbness starts with a detailed medical history. Your doctor will ask about when the numbness started, which areas are affected, and any other symptoms you may have. They'll also review your medical conditions, medications, and lifestyle factors to help narrow down the possible causes. A physical exam helps your doctor assess your nerve function, muscle strength, and reflexes. They may test your ability to feel touch, temperature, or vibration in different areas. This information helps identify which nerves might be involved and guides further testing if needed. Depending on your symptoms, your doctor may order tests such as blood work, nerve conduction studies, or imaging like MRI or CT scans. These tests can help identify nerve damage, vitamin deficiencies, or structural problems that might be causing your numbness. Blood tests can reveal vitamin deficiencies, diabetes, infections, or autoimmune diseases that might be causing numbness. Your doctor will choose the appropriate tests based on your history and symptoms. Treating the underlying cause often helps improve numbness. Nerve conduction studies measure how well your nerves transmit electrical signals. Small electrodes are placed on your skin, and mild electrical impulses are used to test nerve function. This helps pinpoint where nerve damage may be occurring and guides treatment planning. Imaging tests like MRI or CT scans can reveal structural problems such as herniated discs, tumors, or injuries that may be pressing on nerves. These tests provide detailed pictures of your spine, brain, or other areas to help your doctor make an accurate diagnosis. Treatment for numbness depends on the underlying cause. For temporary numbness, simply moving or changing position may be enough. For chronic or serious causes, treatment may include medications, physical therapy, or surgery. Your doctor will tailor the treatment plan to your specific needs. Medications may be used to treat underlying conditions like diabetes, infections, or autoimmune diseases. Pain relievers, anti-inflammatory drugs, or medications for nerve pain may also be prescribed. Always follow your doctor's instructions and report any side effects. Physical therapy can help restore movement and sensation if numbness is caused by nerve compression, injury, or certain medical conditions. Therapists use exercises, stretches, and sometimes devices to improve nerve function and reduce symptoms. In some cases, surgery may be needed to relieve pressure on nerves or repair injuries. Procedures like carpal tunnel release or removing a herniated disc can help restore normal sensation. Your doctor will discuss the risks and benefits if surgery is recommended. Making healthy lifestyle choices can help prevent or reduce numbness. This includes eating a balanced diet, exercising regularly, avoiding excessive alcohol, and not smoking. Managing chronic conditions like diabetes or high blood pressure is also important for nerve health. To prevent numbness, avoid staying in one position for too long, use ergonomic tools at work, and take breaks to stretch and move. Protect yourself from injuries and practice good posture. If you have a medical condition, follow your treatment plan to keep your nerves healthy. Since stress and anxiety can contribute to numbness, finding healthy ways to manage stress is important. Techniques like deep breathing, meditation, yoga, or talking to a counselor can help reduce anxiety and its physical effects on your body. If you experience numbness that is persistent, worsening, or associated with other symptoms like weakness, confusion, or pain, it's important to see a doctor. Early evaluation can help identify the cause and prevent complications. Don't ignore symptoms that don't go away. Remember, numbness that comes on suddenly, affects large areas, or is accompanied by symptoms like trouble speaking, vision changes, or loss of control over bladder or bowels is an emergency. Call for help right away to get the care you need. If you have chronic numbness, working with your healthcare team can help you manage symptoms and maintain your quality of life. Physical therapy, medications, and lifestyle changes can all play a role. Stay proactive about your health and communicate any changes to your doctor. Support groups and educational resources can provide valuable information and emotional support for people dealing with chronic numbness. Connecting with others who have similar experiences can help you feel less alone and learn new coping strategies. Keep track of your symptoms, including when they occur, how long they last, and any factors that make them better or worse. This information can help your doctor make a more accurate diagnosis and tailor your treatment plan. Open communication with your healthcare provider is key. Share all your symptoms, concerns, and any changes you notice. Don't hesitate to ask questions or request clarification about your diagnosis or treatment options. If numbness affects your daily activities, consider making adjustments at home or work. Using assistive devices, modifying your workspace, or seeking occupational therapy can help you stay independent and safe. Dealing with numbness can be frustrating, but maintaining a positive outlook and focusing on what you can control makes a difference. Celebrate small improvements and remember that many people successfully manage their symptoms with the right support. To sum up, numbness can have many causes, from temporary nerve compression to serious medical conditions. Most cases are harmless, but some require urgent attention. Knowing the warning signs and when to seek help can protect your health. Stay informed, take care of your body, and work with your healthcare team for the best outcomes. Numbness is a common symptom with many possible causes. While it's often nothing to worry about, it's important to recognize when it could be a sign of something serious. Listen to your body, seek help when needed, and remember that early intervention can make a big difference in your health and well-being.